All right, why don't we get started? Well, welcome everyone. Thank you for joining us for today's session, Stronger Together Against HIV, Breaking Barriers and Empowering Advocacy. This session will explore the barriers that continue to impact HIV prevention and access to care, and how community leadership and patient-driven advocacy are transforming systems for the better. So my name is Indira Islas, and I am the Director of Government Affairs and Policy at the National Hispanic Medical Association, and I am so thrilled to be your moderator for today. Before we actually dive into the content of this webinar, I wanted to go over some housekeeping items. First is that this webinar is recorded and it will be shared on NHMA's YouTube channel as well as our website. Two, I wanted to remind you all to please submit your questions through the Q&A chat box at any time so that at the end we can go over some of those questions that you may have. So yeah, how about we get into NHMA? So if any of you are not familiar with NHMA, NHMA is a nonprofit membership organization that represents over 50,000 Latino physicians across the US, and our mission is to empower Latino and underrepresented professionals to improve the health of Hispanic and other underserved communities. And we advanced this mission through leadership development, health policy and advocacy and education and strategic partnerships, as you will see through our panelists, as well as federal agency, academic institutions, and other community-based organizations across the country. And so now what you all are waiting for is we're so honored to be joined by three incredible speakers today who bring deep expertise, lived experiences, and commitment to health equity. You'll hear from JP Hernandez, who is the Senior National Coalition Manager at NMAC. We have Carla Quesada Torres, HIV Senior Prevention Specialist at Gilead Sciences. And we have Angel Vogel, who is a trans advocate and student services specialist at the University of California, Davis LGBTQAI Resource Center. And each will share their perspective on the barriers to HIV care and the power of advocacy in driving meaningful change. And we'll follow the presentations with a moderated panel and live audience Q&A at the end. So as I mentioned, our first speaker is JP Hernandez, who will speak about the systemic barriers in healthcare, including stigma, discriminations, and some of the insurance challenges, and how social determinants of health impact HIV-related outcomes. So without further ado, I will hand it over to JP to kick it off for us.
Thank you so much, Indira, for the introduction, and thank you to NHMA and the rest of the team for the opportunity to be here today. Really happy to join all of you for this conversation. So as Indira mentioned, my name is Juan Pablo Hernandez, but I do go by JP. My pronouns are he, him, and él, and I'm a senior manager at NMAC's Coalition for Justice and Equality Across Movements. I'm also a lawyer by training, an advocate, and a policy wonk who works at the intersection of public health, equity, and movement building. So I come to this topic from an advocacy perspective, not necessarily from a clinical or purely data-driven point of view, but with a focus on how these issues show up in our work with communities and the policy fights we are part of. So yeah, it's an honor to be here and talk about the systemic barriers to HIV care. But before diving into today's topic, I just want to take a moment to ground us in who we are at NMAC. And if we can go to the next slide, please. And then the second one. Awesome, thank you. So NMAC, since 1987, NMAC has not only been at the forefront to fight to end the HIV epidemic, but it has done so by advancing health equity for communities of color, working on the intersection of policy, leadership development, and community engagement. We have 7 core divisions and teams, including the training center to end the HIV epidemic, our treatment team, our conferences, and our development divisions, our comms team, the strategic partnership and policy team, who I also collaborate with, and the Coalition for Justice and Equality Across Movements, which is where I work. And we've always been we've always believed deeply in the power of partnerships. So in 2016, Emma co-founded the partnership to end HIV, STDs, and hepatitis alongside other national organizations, AIDS United, NASTAD, the National Coalition of STD Directors, and the AIDS Institute. And that was recognizing that fighting HIV also meant showing up for broader public health battles. And with that belief in collaboration, in joining forces across causes, that it was foundational to everything we do. And with that in mind, in January 2023, NMAC launched the Coalition for Justice and Equality Across Movements. And if we can go to the next slide. So the coalition builds on decades of coalition work, but with a broader mandate, which is extending our advocacy beyond the HIV movement to respond to rising interconnected threats to health, safety, and civil rights. So we bring together national advocacy organizations working across racial justice, LGBTQ plus rights, women's rights, immigration, aging, and a plethora of other issues. And the idea is to build collective power for an intersectional agenda that centers the needs of our most vulnerable communities. And we mobilize through shared strategy, through coordinated messaging, and solidarity across all the movements. And if we can go to the next slide, I'll show you a quick look of who's in the coalition. This is just a snapshot of some of our members, so national organizations, state groups, and grassroots leaders. We're really proud to have strong Latina partners within our coalition, such as the Latino Commission on AIDS, the Trans-Latina Coalition, LULAC, and NHMA, among others. So yeah, it's a very diverse group of partners, and that's intentional. Because we believe the challenges we face are deeply interconnected, and our solutions have to be interconnected too. So yeah, that brings me to where the landscape we are operating in and why it really matters. So yeah, now talking about the landscape we're navigating, advocacy today, as we all know, is happening in a very hostile political climate. We are seeing this wave of anti-LGBTQ plus, anti-immigrant, and anti-public health legislation, and that includes restrictions on gender-affirming care, rollbacks on reproductive rights, immigration crackdowns, and cuts to safety net programs. And these measures don't just make our work harder, they shape who feels safe accessing services, how we fund and communicate our programs, and even which programs can exist at all. And misinformation and polarization add another layer, making it harder to build consensus. And this is where trusted messengers and community-driven advocacy becomes essential. So our strategy and our solidarity have to be strong enough to meet the moment we're living in. And one example of that is the work coming from NMAC's treatment division, specifically, I should say, the Gay Men of Color Fellowship, led by my Boricua colleagues, Moises Agosto and Damian Cabrera. And if we can go to the next slide. So yeah, the fellowship focuses on gay and bisexual men of color and takes a participatory action research approach, which basically means the community is in the driver's seat from start to finish. In 2024, as part of that work, the fellows led a study that combined focus groups and surveys to really dig into beliefs, attitudes, and barriers to PrEP. And what they found probably won't surprise most of us in this space: stigma, cost, limited provider knowledge, and system-level hurdles that still keep too many people from getting PrEP. But it wasn't all challenges. The research also pointed to real opportunities. So people said they wanted PrEP integrated into routine care, offered free or at low cost, and made available in spaces that are stigma-free and culturally affirming. And the solutions they proposed weren't imposed from above. They came from the ground up. So peer outreach, trusted messengers, and community-led education campaigns. And all of that paints a really vivid picture of what's possible, but also sets the stage for talking about the bigger systemic barriers we are up against. And by the way, I'll drop the link to the study in the chat for anyone who wants to take a deeper look. And if we can go to the next slide, please. So when we look at the HIV care landscape, the challenges are not just individual, they are baked into the systems we navigate. We are up against structural racism, xenophobia, and anti-LGBTQ plus policies that just don't exist in the background. They actively undermine prevention and care. Also, there's a surprising lack of provider knowledge about PrEP and PEP, two of our most powerful tools. And even when care does exist, our system often make it inaccessible. So long waits, limited hours that don't work for working people or caregivers, poor follow-up. So yeah, layer on stigma and the fear of disclosure, and both of which can keep people from even stepping into a clinic, and the picture gets even harder in the HIV space. So and of course, financial barriers remain a constant. Gaps in insurance, burdensome prior authorizations, and out-of-pocket costs that push care out of reach for a lot of people. And these aren't isolated problems, they are connected and they reinforce each other, which makes it even harder. If we can go to the next slide, please. So when we break those barriers even further, we see how deeply stigma runs. Societal stigma, institutional stigma, and even internalized stigma that erodes that self-worth and care seeking. And we see discrimination based on race, on sexual orientation, on gender identity, or on immigration status, often in spaces that are supposed to be free. Insurance issues are just another wall to that. You know, the denials for PrEP, as I mentioned previously, no Medicaid expansion in some states, and gaps in the Medicare coverage, which we all know have been a particularly hot topic in the last couple of weeks. So that's also a huge barrier. There's also a deep mistrust in healthcare system, and that mistrust isn't irrational. It's grounded in lived experiences of neglect, of harm, and of exclusion. And finally, we have the structural policies themselves, which we already mentioned, that can be gatekeepers, blocking immigrants and transgender people and low-income patients from the care they need. And all of this intersects directly with the broader social determinants of health, and that's where we're going next. So next slide, please. So when we talk about social determinants, we mean the environments and circumstances people live in from birth to old age, and the policies, programs, and systems that shape those conditions. So if someone has stable housing, access to employment, and a livable income, their HIV outcomes are very different from someone without those supports. So transportation, clinic locations, work schedules, those practical details can mean the difference between getting care or going without. And language access and cultural competency are still uneven across the system, which makes care harder to navigate for many of our communities. And as I mentioned, cost remains also a major driver for inequity, particularly for lower income and older individuals. And our gay men of color data shows that BIPOC, LGBTQ plus communities, these in these inequities are compounded by systemic exclusion and mistrust. So the question is, how do we start to shift that reality? And in the next slide, we will look at what's working in practice. So we know change is possible because we've seen it in the world, in the work we all do. For example, when we invest in BIPOC and trans-led organizations, not just with funding, but with real capacity building, the impact multiplies. We create safe, stigma-free spaces for care, like community-based PrEP access points. We bring services the people need, such as legal clinics, know your rights, resources, advocacy toolkits directly to them. Also, peer-led outreach networks have been game changers in connecting patients with affirming providers, and across sector advocacy, where healthcare, housing, legal aid, and policy groups join forces, that has real power to push back against harmful laws and policies. But as we do this work, we can ignore the reality of the political climate we're in, and navigating that climate is a skill in itself, which is why I'm going to digress for a moment and talk about what we've seen actually works for navigating a hostile political climate, because it's all interconnected with the barriers and solutions we've been discussing. So yeah, our progress doesn't happen in a vacuum. We're working in an environment where the political climate can turn on a dime, and sadly, particularly in these times, we're living it seems to be always against the communities we serve. And one of our most effective strategies is alignment across movements. So finding the shared goals between racial justice, LGBTQ plus rights, immigration, women's rights, reproductive rights, and public health. And another tool that has really worked well for us and in our coalitions, it's using rapid response tools, so sign-on letters, petitions, coordinated calls to action, so we can mobilize quickly, and we make sure our partners have what they need. So policy briefings, toolkits, messaging guides, all in accessible formats. So we also try to lift up community stories to show the human impact on policy decisions, because we believe stories move people in ways numbers alone can't. And yeah, we also build bridges between national advocacy and local grassroots work, so we can protect and expand care even in hostile environments. And all of these partnership, rapid response, lifting up community voices, it only works if we can get the message across. So next, I want to talk about how we do that, how we make sure our message lands even in a really polarized environment. So yeah, messaging is our connective tissue. It's what makes all of this land. And we have to frame issues in a way decision makers can actually hear. Sometimes that's about cost, sometimes that's about outcomes, and sometimes it's about that human story we were just mentioning. So we adapt our language without compromising our values. We back it up with local data, with coverage rates, with costs of inaction, with community impact. And we center patient and provider voices, because that's what drives empathy and urgency in a way policy memos never will. And we also drop the jargon, because real change happens when people understand what's at stake. So yeah, this is how we make sure our advocacy cuts through in a polarized climate, and how we keep building toward the long-term change we're here for, which brings me to my final slide. So advocacy is strongest when it's rooted in community and lived experience, and we need policymakers, providers, and advocates working together to dismantle these systemic barriers. So yeah, my last ask is, if you're looking to connect for a way to connect your work to a national advocacy, join our Coalition for Justice, no dues, just commitment. And also I want to invite you all to USCHA, which is happening now in September 4th through the 7th at the Mario Marquis in DC. We are just three weeks away. Magic Johnson will be one of our headliners, and there will be plenty of surprises. And we'll also be hosting a pre-USCHA Hill Day on September 3rd, and starting a series of virtual advocacy trainings this week. So if you're interested in participating, please reach out to me, and you can, if you can all scan that QR code, let's connect and let's keep building this community together. And that's it for my part. Thank you.
Thank you so much, JP. You really helped help us set the stage for why this issue is so important, and how structural and systemic challenges continue to impact HIV outcomes and access to care. So we appreciate everything that you do and appreciate the work that NMAC does. And I highly encourage everyone to check out the conference and all the activities that they have coming up. And now I'd like to introduce our next speaker, Carla Quesada Torres, who again is the HIV Senior Prevention Specialist at Gilead Sciences, and she will discuss the role of community-based advocacy in addressing structural barriers and advancing culturally responsive HIV prevention efforts. So Carla, I will hand it over to you now.
Good morning, good afternoon, everyone. Thank you so much for inviting me to participate in this incredible panel on such an important topic. And JP, for setting the foundation, a strong foundation of how we take these national initiatives of advocacy and bringing it to the local community level. I am Carla Quesada Torres, multicultural, bilingual HIV prevention specialist working across California, Southern California. I am really going to base my knowledge and my expertise and my over 25 years of experience. The views that I'm going to be sharing with you today are not necessarily those of Gilead, but of my own and my 20 plus years of experience. So thank you for that. Next slide, please, Indira. So what we're going to be covering today, just a little bit about who I am. JP mentioned stories matter, and stories are really important. So when you do take the time to learn about the individuals, especially at that community, and you start defining where health, where equity intersects, we're going to go into that community-based advocacy, breaking down these barriers, and then sharing some real-world examples. I love to get the audience always in part of a discussion. So as you're thinking about real-world examples, put it in the chat. Put yourself as an example, put your agency, put your journey in this so that we can share from each other, learn from each other, and implement your real example into other areas across the nation. And we're going to highlight some cultural responsiveness strategies. And at the end, a call to action for all of us to make sure we're ending the HIV epidemic for everyone, everywhere. Next slide, please. So for those of you that don't know me, I was born in El Salvador, brought to the US, South Central LA to be more direct, by my parents, because they were fleeing the war, the high crime rates in El Salvador, which, as you can see, coming to LA back in the early 80s, it wasn't that much different than what we were experiencing with gangs and violence, right? So there's a saying in Spanish, te vas de Guatemala para irte a Guatempeor. You leave something bad and you might go to something worse. That's pretty much what people were saying. You just really left one bad place to another bad place because of the gangs, the violence, and all of that. I honestly say that for me, it was the moment that brought me to building that resiliency and that passion and that commitment to supporting communities that need it the most. In that case, the migrant communities that were living, that were struggling in LA. And my heart goes to everyone that is struggling right now with all of the rapes and situations happening in LA. So then for me, that passion and that commitment came about in supporting and drove me to begin my career at San Diego State University. So from LA came to San Diego, and you can see my journey of starting my bachelor's degree all the way to where I'm at today. And like a Latina that I am, very proud, in between my schools, my education, my career, my jobs, I had family. I met my husband, I have my children, and now I'm a happy glamour of a 1-year-old too. So again, stories do matter, and that's important to know these stories of the communities that we're serving, and why, if someone comes to me as a Latina mom, they really want to bring in the center of my home, which is my family, before they invite me to take part in any type of advocacy, because I'll put my family, my community first. Next slide, please. So what is health equity? We have experts in the room that understand health, and they work and thrive to make sure everyone has an equal opportunity to live a long and healthy life. That's the definition. Are we there? Absolutely not, like JP mentioned, right? Next slide, please. A lot of these are all about these inequities that JP mentioned, right? Obstacles that we see, like poverty, discrimination, lack of access, where we didn't get a chance to start all at the same place, right? So here's the role of where community-based advocacy is so important, because as professionals, we are also in a position of privilege, where if we're not centering the work that we do with the community in mind, then we're not doing the justice adequately for the communities that we need to serve, especially when it comes to HIV prevention, where if you all can start thinking about the barriers that your HIV community is facing, put it in the chat, please, so we can get some interactions. What are those barriers that you think you're seeing that JP mentioned? The stigma, is that more of a stigma? Is it poverty? Is it lack of access? Is it awareness, right? And we can take a deeper dive now into what these are in the next slide by breaking down these barriers that have been mentioned, like systemic racism. What about colorism? People don't think about colorism. And that, for me as a Latina, and I do want to call out my privilege, I am a Latina. I am on the lighter side of Latina. And I can assure you, as a Latina being on the lighter side, that is a privilege that not everyone has. And that's something that I have to be mindful of, that I also have to speak about, and I have to mention it, because my friends, my family, my siblings, my brothers and sisters don't have that. And I get treated differently. And that goes back to even going back to my home country and what how I'm being treated in the healthcare systems too. So keep those in mind too. In addition to these barriers, you see the language, the stigma, the need for policy reform and trust building is key in how we break down these barriers, and access to making sure that everyone is able to request an HIV test without being judged, without being acknowledged in a negative way because they're asking for it, and the fear that they might say, well, how many partners are you having, right? The assumption that only people who, and I'm going to use the term which I really hate, promiscuous, should be getting an HIV test, because that's the reality that we're still seeing out there in people asking for an HIV screening. Next one, please. So some real world examples that I was able to pull out, and this for me is only a few, and I know that a lot of you are in here. I saw some folks from different agencies across the nation. Put in your real example, put in your link, put in your contact information in the chat. This is being recorded, and again, people want to know what is out there. Some of us, for example, Positively Trans empowers trans people living with HIV to lead research and policy change. When JP mentioned medical mistrust and distrust, that is rooted on experiences, lived experiences. It is not back in 100 years ago. This is recent. COVID situations happen. Who were the most affected? Communities of color, people of color like you and I, right? People were dying, were left in spaces that, because they weren't able to access the care, speak to their provider, or they weren't believed. So that's the kind of stuff that real community advocacy examples are the heart of, and where we have to be mindful of what new conditions are out there that we have to bring back our community lens and help that end, especially in the epidemic. The Black AIDS Institute, helping Black leaders to advocate for culturally responsive care. Stories in these Black AIDS Institutes is incredible. Check out the website, work with agencies like them. Bienestar, providing Latinx LGBTQ communities with tailored HIV services. And this is one new one that we are working with the Planned Parenthoods of the Pacific Southwest, where they're providing rapid PrEP and ART programs, offering same-day access to treatment regardless of status. ACT UP, for example, is another one, taking direct action, demanding treatment and access for systemic neglect. Start putting in your examples, please, in the chat too, of what you have accomplished, what you have seen. And for here is when we look at this healing from our community is through our cultural relevance, right? How do we bring this together with real examples? We began by bringing in the experts into the room. We're centering the community voice by the community, for the community, because they're the important ones in leading these efforts. Some examples could be making sure your teams are diverse, that you have a diverse group of people from all ages, gender, sexual orientations, outreach teams, your peer-led support groups, that your programs are tailored to meet the needs of the communities that you're serving: Latinx, LGBTQ, Latinos, Latinas, Black, African American. This will ultimately help with engagement, building that trust and building that relationship, and at the end will lead to health outcomes. What are these health outcomes when it comes to ending the epidemic? Increasing people knowing their HIV status, increasing knowledge that regardless of that HIV status, individuals would benefit from a PrEP regimen. If that HIV screening comes back reactive, they would benefit from getting on a rapid ART treatment to quickly become undetectable. And we all know that messaging, undetectable is untransmittable. But if you speak to our communities, they'll tell you that they don't know that message, they've never heard it, or they don't understand the science behind it. So again, bringing in healing through cultural relevance will lead to improved health engagement and health outcomes. Can you please go into the next slide? So some advocacies can be done within clinic walls. Peer navigators, patient advisories, training providers in cultural humility, and embedding community voices into our care models. I'm going to share some examples. Again, stories do matter for me, and they're so important to share. Back in 2006, the CDC put out some guidance on everyone should be tested between the ages of 13 to 65, right? Do you remember those guidance? And I remember that. I'm like, wow, so people over the age of 65 are not having sex. Boom, red flag. The other one, people under 13 are not having sex. And I clearly remember some of my friends in middle school already being sexually active. Then they said, maybe the guidance of opt-out HIV testing. Wonderful idea. Everyone is going to be offered an HIV test, automatically are going to be given an opportunity to opt out. If not, they're going to go ahead and get an HIV test. The clinic that I was working for at that point, San Ysidro Health, decided to come together and bring focus groups. And we asked them, what are your thoughts about getting an HIV test as part of your standard of care when you come into a physical? You get your A1C, you get your lipid panel, and we're automatically tying an HIV test. Patients thought, why isn't that being done already? Mind blowing for us. You're absolutely right. Why weren't we doing that in the first place? Patients were under the assumption, and we're speaking about patients who were as young as 13 all the way to 85, 90 years old. Okay, huge call right to action for us because we had no idea where we were at. Next slide, please. Stronger Against HIV means bringing in center community voices, dismantling what these structural barriers, collaborating with equitable HIV prevention and treatment needs, making sure that the voices that we're bringing into their community are actually true, authentic, and that when we say we're going to include your voice, we're going to include your story, we're going to take this and make it an actionable area, that we come back and hold ourselves accountable. This is what we did with the information you provided us. This is the information that we couldn't use for A, B, and C. It could be even as funding didn't allow us to do this. Why? Where can we do this differently? We have to build on that trust with our communities in order for us to continue growing that allyship with them. Next slide, please. Getting involved then means like volunteering with local health organizations, engaging with others in social media. Keep learning and sharing with others how they can participate. For you to participate, meaning not only because your job is asking you to participate, not only because you're getting paid to go to a Pride event or an AIDS Walk event or something like that, it means participating even when you're not asked to participate, when you're not told you're going to be getting your 8 hours a day. Participate because it's really what the community needs, and representation and that trust is going to follow with that. Next slide, please. So now is the call to action. I want everyone, we have over 50 people in the room. I want to everyone come back and say, I commit to dismantling these barriers in my community, and I commit to making sure I'm holding myself accountable and holding each other accountable to end the HIV epidemic by centering in our community first. And if you agree with this statement, I want to see yes, 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 all over the chat as we bring in our next speaker, please. And that will be, thank you so much for your time and attention. Community matters. Community is the heart of what we do, and that's the only way we're going to end the HIV epidemic. Thank you, everyone.
Thank you, Carla. I think you're getting a lot of amens in the chat in response to everything you just said. So thank you for those insights and the impactful presentation and for centering the importance of cultural responsibility, because we all know that there is a lot of medical mistrust and distrust, and it's going to take a long time and coalition building to get past that. And so now I will turn it over to our final speaker, Angel, who is a trans advocate and student services specialist at the UC Davis LGBTQ IA Resource Center. Angel will highlight the power of patient-driven advocacy and will also share some examples of successful community efforts and discuss how people can engage in organizing and systems change. So, Angel, I will turn it over to you now.
Thank you, Indira. And I just wanted to say thank you all for inviting me into this space. I spend a lot of my work within LGBT spaces and have been trying to intentionally connect more with my Hispanic roots and supporting the Hispanic community. So yeah, next slide. Oh, next slide. Sorry. Okay. Yeah. So some objectives for today. I'm going to talk a little bit about who I am, my story, how I help steward the LGBTQ plus community through key partnerships. Then we'll dive into how patient advocacy influences healthcare and policy services, give some examples of successful advocacy efforts, and then we'll talk about how folks can engage in self-advocacy and community organizing. Next slide. So a little bit about me, Angel Vogel, I, she, her, ella pronouns. I'm a trans Latina. I was born in Guanajuato, Mexico, and I now reside on Nistanon land in Sacramento, specifically in Oakland. And I wanted to talk about a family connection that I have to HIV just because it's a good example of calling in. So when I was 11, this was in the early 2000s, one of the ways that me and my friends would poke fun at each other is saying like, you have HIV, because we saw on the news, there was a lot of HIV scare. And so this is one of the thoughtless ways that we made fun of each other. And one day my sister called me in and she said, hey, Angel, it's not okay that you are making light of HIV, and I want you to know that someone in our family is infected with HIV. And what I knew about HIV at that time was that a lot of LGBT people were contracting it. I never thought that somebody who was cis and hetero would be able to contract HIV. And so it humanized the issue for me. It helped me realize like that words matter and that words can hurt. Um, and so, yeah, I've spent most of my life now advocating for the LGBT community and supporting folks with HIV. Um, and and really thank my sister for calling me in that moment. In my professional life, I am a trans advocate and student services specialist at UC Davis at the LGBTQIA Resource Center. And then another hat that I wear is as the chair of the Stonewall Foundation of Greater Sacramento. So most of my professional work is rooted in LGBT advocacy and care. And so we work with organizations that support HIV patients as well. Next slide. So in my role as a trans advocate, I went into the role meeting different partners on campus who were already doing case management, learned about the gaps in service that were presented, and so I focused my work mainly on supporting trans students. I do support the broader campus community, but my focus is primarily on trans students, and so I support them with finding affirming providers, getting them legal services for name and gender marker changes, supporting them with coming out at home or on campus, and helping them navigate harassment and discrimination on campus. And so inevitably, I do work with individuals who are diagnosed with HIV and are dealing with mental health struggles associated to that. My work also involves a lot of advocacy. So I work closely with the Student Health and Counseling Services, which has a gender care team. And I also consult with student-led clinics such as the Amani Clinic, which runs out of Sacramento and primarily serves communities of color, marginalized folks, and folks who have HIV. Just kind of, I consult with them to kind of convey how they can better support the trans community. And the work comes with a lot of obstacles. Of course, being in higher education right now isn't an easy feat because of some federal restrictions and demands that we are abiding by, unfortunately. And also, I am located in Davis. So in Davis, it's a testing desert, which means that there's not a place in the county where folks can get a free test with a medical provider outside of someone who can take their insurance company. Now, our center does offer free testing kits, and so that is an option in Yolo County, but it doesn't replace the level of support that patients can get from a patient advocate or a medical provider. I'm kind of walking them through like what now after they get that positive HIV test. Next slide. Then, in my role as the chair of the Stonewall Foundation of Greater Sacramento, most of our work is based around supporting education and mental health. So we provide scholarships to students in the Los Rios colleges, Sac State, and we're working on an endowment at UC Davis specifically to address research funding cuts. And so we would like the funding to go towards work that would support the LGBT community, really in any field. And then we support K through 12 through partnerships where we help fund an annual LGBT retreat that is hosted by Sac City USD. And then we also provide some scholarships to high schoolers. Part of our work also includes key partnerships in the community. So one of those is with Sunburst Projects, which has been around for about 40 years. And they started by providing camp like a free camp experience to students who were diagnosed with cancer, and that quickly shifted to camps for kids who are diagnosed with HIV and AIDS. So they have programs that address medical needs, mental health needs, social support, childcare, as well as HIV/AIDS education and prevention. And so what we do there is fund a full-time supervisory position for mental health providers who are trying to get their hours just to build that pool of affirming providers. And then we also partner with the Gender Health Center, which is an organization here in Sacramento that has a hormone clinic, and they also do HIV and STD and STI testing. And so with them, we support we pretty much fund one person to go through electrolysis school because in trans care, if you would like to get certain procedures done, you have to have access to electrolysis, and it also reduces dysphoria when done like in different areas. And so we fund that position, and then they are committed to providing their service out of the Gender Health Center for a year. So what we've really done is looked at our community and seen where we can plug in to established organizations who are already doing such great work. So yeah, super proud of that work. So when we're thinking about advocacy, what we do is humanize the topic through storytelling. So including patients' voices and HIV advocacy. Apart from data collection is what really pushed for research, treatment, development, and patient care programs. The organizations that I mentioned, my foundation supports, are great examples of this. Sunburst Project, like I mentioned, first grounded their work in supporting children who the public more easily were able to hold empathy for. And as the public support um, for HIV patients grew, and they realized that it wasn't just a gay disease, but something that could touch them too. Um, they utilized that strategy, and HIV orgs were able to get the political capital to fight for care for LGBTQ plus folks. Um, but nobody fought alone. So there were a lot of strategic organizing amongst community orgs, grassroots organizations, medical institutions, and that all created a network to advocate for more effectively and influence policymakers and influential stakeholders. But emotional appeals don't work for everyone. So we also utilize data and calling out misinformation. So educating to inform advocacy. And they were able to reach folks who did not respond to those emotional appeals. Um, and now we're seeing a rolling back of LGBTQ plus care, or at least an attempt, and it's certainly happening already in the trans community. But the Supreme Court ruling on HIV care coverage, which is very nuanced, the ruling came out on June 27th in Kennedy versus Braidwood, and it upheld access to cost-free preventative health services under the ACA, including cancer screenings, PrEP, and HIV, and other conditions. And the case questioned the constitutionality of the U.S. Preventive Service Task Force, which recommends covered services. So it was a 6-3 decision, and the court found that the panel found the panel constitutional, but clarified that the HHS Secretary, Robert Kennedy, has the authority to appoint, remove, and override task force members and their decisions. And especially given his controversial views, this could be a threat to access to preventative care. And in California, we really need to do our part and hold the line to ensure that we're able to fight for what our communities need. Next slide. So some successful cases of advocacy that really ring true to my heart are one of them is the case of Ryan White, who was a teenager who contracted HIV through blood transfusion in the 80s. That brought a lot of attention to the stigma and lack of care facing the community. And after he was barred from going to school because of his diagnosis, this was a time when people thought that you can contract it by touching someone who has HIV. Um, him and his family became outspoken advocates for HIV awareness and compassion. And his story further humanized the epidemic and shifted public perception. Um, but following his death in the 90s, the US Congress passed the Ryan White Comprehensive AIDS Resource Emergency Act, or CARE Act, and that provided federal funding for HIV treatment and care for low-income, uninsured, and underinsured individuals. And the program still remains today, but it's always under threat because of budget cuts. Luckily, we still have it today, though. Um, Community advocacy also played a role in attaining the level of care that we enjoy today. And that in part came from influential people like Princess Diana, who also humanized the disease. And she helped dispel stigma and misinformation with a simple gesture of touching HIV patients on camera. And this was again during the time when people thought that they can contract it by physical touch. So advocacy from folks involved in work to secure funding for key roles. Yeah, it's a team effort, and it's continuous, and there are highs and lows. Right now we're at a low spot, but I think that by being in spaces like this and finding places to plug into, we can be effective advocates for the community. Next slide. So HIV patients can self-advocate by actively participating in their care, learning about their condition and treatment options, and speaking up in medical settings. So I face this in my role on campus. Students who would like a certain level of care that they're not getting from their provider. This is mostly around HRT, but these are also young adults who are still learning how to navigate healthcare. And so I often have to sit with them and kind of guide them through how to self-advocate and how important it is to do that. Because even as an adult, who has good health insurance, I still see providers who know nothing about gender and what it means to be trans, or about gender care. So it's very pervasive. So it's very important that patients learn to speak up for themselves. So in understanding their legal rights and joining support or advocacy groups and sharing their stories when it's safe, can help reduce stigma and push for better policies. And then keeping track of their health and demanding access to comprehensive care, including mental health services, strengthens their ability to take control of their own well-being and fight for dignity and equality. And finally, patients aren't alone. So often, if they feel uncertain about self-advocating, or they have a fear of approaching their provider in a certain way, I encourage them to reach out to a patient advocate wherever they see their provider, and I'm always happy to talk with them as well. Next slide. Yeah. And so for the resources, I really wanted to boost Sunburst Projects and the Gender Health Center because I really believe in their mission. They both saw gaps in services in the community and addressed them in really innovative ways. The Gender Health Center in particular is led primarily by trans folks who hold a high level of humility. And that's one of my top values, I think, when working with patients who have HIV or trans individuals or LGBT folks in general, marginalized communities. It's important to know that that we don't know everything, and we have to listen to our patients and the people that we serve, and include their voices in everything. And so I think these two organizations really do an outstanding job doing that. So I recommend you reaching out to them. And next slide. And then you can also reach out to me through my UC Davis or foundation emails, depending on what your need is, but I'm happy to connect afterward.
Thank you so much, Angel, for not only sharing your personal story, but highlighting some of those lived experiences from other individuals who have shaped this landscape. And also, there is strength and power in storytelling. Although it's not easy, it's not always easy for people to come out and share their stories. So thank you for that. I know we could go on for hours just talking about this, but I wanted to give our panelists here an opportunity to answer some questions that we have. And I'll start with one question that we have in the chat. And I'm going to read it because there's some background to this question. And so it says, one of the recent wins that we have won in HIV and healthcare is the expansion of the HIV Organ Policy Equity Act of 2013. The recent expansion made kidney and liver transplants from donors with HIV to recipients with HIV medical standard of care in 2025. What can NMAC, NHMA, and other organizations do to pledge, and others pledge to do to spread the word to people with HIV that are at increased risk for end-stage organ disease and the people who care for them?
I'm happy to
Take it
take
over.
that one.
Yeah, please go for it, JP.
Yeah, that's an incredible win, Nina. So thanks for lifting it up. I think one big thing we can all do is make sure this information doesn't just stay in policy circles, but actually reaches providers, case managers, and community-based organizations who work directly with people living with HIV. And for NMAC's part, we can help amplify through our networks, trainings, and our conferences. And yeah, I also love to hear ideas from folks here on creative ways to make sure this gets into patient conversations early.
Thank you, Jake.
Yeah, sorry, Indira, agree with
No.
JP. I think we have national platforms, right? Like we celebrate, commemorate, and honor National Faith HIV/AIDS Awareness Day, World AIDS Day, AIDS Walks. Those are great national platforms where we can plug in education and awareness to the communities of these policies that maybe they weren't even aware of, from people living with HIV to case managers to directors at clinics and hospitals. I think it's really good to bring in what has been already created and start messaging the changes in how we are going to end the HIV epidemic in this new era.
Thank you, Carla. And while I have you talking, I'm going to direct this question to you. Oh, but first, let me make sure there's no other questions from the chat. Okay, no other questions. How can corporate and community partnerships work together without kind of losing sight of some of those health equity goals? As we know, it's very, very easy to lose sight of goals, but any thoughts on that?
Well, first of all, putting in the community at the heart of what we do, right? And addressing with sincerity, what are these goals of health equity? Where is it that corporate is coming in? We have to look at ending the epidemic with the specific measures, like when the National HIV/AIDS plan came out, increase HIV screening, link people to PrEP, link people to PEP, link people to ART. But how are we going to be accomplishing that? And when you bring in communities in these decisions, they're going to tell you, what if you're going to be outreaching to specific communities, the way that you outreach to young LGBTQ is not going to be the same outreach efforts that you're going to use for Latinx, right? For people that don't identify and don't adopt the term X or E at the end, right? That's very different when I think if we're going to be ending any conditions, any diseases, especially HIV, we have to come together and be very clear on what intent the corporates have, what intent the funders are asking for, and then where the community sees this as an opportunity to help support their health needs and dismantling these barriers, whether it's systemic or social barriers that they have.
So very, very true. I think we oftentimes tend to generalize, right, communities and assume. Thank you so much for answering that, Carla. Angel, I'm going to ask you one question, and then we may have to wrap it up there. But in what ways can providers, advocates, and public health leaders better support transgender and non-binary communities?
Yeah, so I think that working intersectionally and looking at the different identities that trans people hold, and seeing what the gaps are in services for them is a great way to do that. Oftentimes we're pigeonholed into one identity, but even within the trans community, there is a difference in care and the way that folks are treated depending on what their race is and what access to resources they have. Yeah, so could you repeat your question?
Yeah, just ways in which providers, advocates, and public health leaders can come
Oh, yeah.
together to support the transgender community. So I
Okay.
think
Yeah,
you
that
answered
yeah.
that. Thank
Thank
you.
you.
And I think that is all the time that we have for questions. And I know that all of the speakers here have shared their contact information. So if you have any other questions, please feel free to reach out to them. And as they've all mentioned, coalition building is so important. So let's connect. So thank you again to our speakers, JP, Carla, and Angel for taking the time to be on this webinar, share your insights and expertise with us today. And before we close, I just wanted to highlight some important resources and next steps. If you want to join, I want to point you to tools and information from CDC's Let's Stop HIV Together campaign. And these resources are available in English and Spanish and are designed to support prevention, testing, and treatment in diverse communities. So please check them out. We have other upcoming virtual events. We hope to see you at our September webinar that is focused on empowering community health workers and HIV prevention and care. Community health workers are so essential to this, as in other capacities. So please join us for that. We also encourage you to follow NHMA on Instagram, LinkedIn, Facebook, and all the other socials. And I wanted to point you to nhmahhf.info. You can access and download resources here. And we also have some bilingual resources, a bilingual education hub. And if you're not already an NHM member, I invite you to be part of our network, and whether that's either your provider or an advocate or a medical student or community leader, we invite you to join the organization and be part of our mission. Next, I wanted to point you to the NHMA job board, and it highlights resources that NHMA offers, whether you're seeking your next career move or looking to recruit top talent. And this platform connects job seekers to active employers. So check that out. And I think that concludes our webinar for today. Thank you again for joining us, and please stay in touch. Thank you all.